A patient with COPD is receiving oxygen therapy. Which oxygen saturation target is most appropriate? Correct option is C. A nurse noticed a patient suddenly develop slurred speech and right side weakness. What is the priority nursing action? Correct option is B. Which finding in a patient on mechanical ventilation indicate ventilator associated pneumonia? Correct option is B. During chest tube drainage, continuous bubbling and the water seal chamber indicate. Correct option is B. A nurse is caring for a burn patient which electrolyte imbalance is most expected in the first 24 hours. Correct option is C. A patient with atrial fibrillation is started on warfarin. Which food should the nurse avoid to limit? Correct option is B. A patient on lithium therapy present with tumor confusion and polyuria. What is the nursing priority action? Correct option is A. Which condition is best confirmed by a positive human signs? Correct option is B. A patient develops shortness of breath after central line insertion. The nurse suspects pneumothorax. Which diagnostic test confirm it? Correct option is B. Which nursing action is essential when administering IV potassium? Correct option is C. A child with nephrotic syndrome is on corticosteroid therapy. Which nursing intervention is most important? Correct option is B. A patient with the increased ICP develop unequal bowels. This indicate. Correct option is B. Which sign indicate hypocalcemia after thyroidectomy? Correct option is A. The nurse is caring for a post-op hip replacement patient. Which position should be avoided? Correct option is C. And peritoneal dialysis, which finding should be reported immediately? Correct option is B. Which lab value is most important to monitor a patient on amphotericin B therapy? Correct option is B. A nurse prepared to administer packed red blood cell. What is the maximum infusion time allowed? Correct option is C. Which intervention prevent hip dislocation in infant with development dysplasia of the hip? Correct option is A. A patient on chemotherapy reports painful mouth ulcer. Which nursing action is best? Correct option is C. Which ECG change is expected in hyperkalemia? Correct option is B. Which drug is used to treat organophosphate poisoning? Correct option is A. A nurse is Caring for a patient with acute pancreatitis, which liberty finding is most significant? Correct option is A. Which action is priority when a patient is suspected of having meningitis? Correct option is B. Which symptom is typical of myasthenia gravis? Correct option is B. Which test is used to confirm pulmonary embolism? Correct option is B. What is the first nursing action if a chest tube becomes dislodged? Correct option is B. Which electrolyte imbalance is expected? An adrenal insufficiency. Correct option is B. In a patient with ARDS, which ventilator mode is often used? Correct option is D. Which position is recommended for a patient after liver biopsy? Correct option is C. A patient receiving chemotherapy develop a white blood cell count of 2000 per mm. The priority nursing action is. Correct option is B. Which acid-base imbalance is seen in diabetic ketoacidosis? Correct option is B. Which dietary advice is best for a patient on monoamine oxidase inhibitor? Correct option is A. Which vaccine is recommended for a newborn within 24 hours of birth? Correct option is B. What is the therapeutic drug level of digoxin? Correct option is B. Which complication is most associated with immobility in ICU patient? Correct option is A. A nurse assesses a patient with right-sided heart failure. Which symptom is expected? Correct option is B. Which drug is given to accelerate lung maturity in preterm infant? Correct option is B. Which electrolyte is most important to monitor in tumor lysis syndrome? Correct option is A. Which nursing action reduces risk of ventilator-associated pneumonia? Correct option is B. Which condition is indicated by a positive Vostek sign? Correct option is B.